Hi, everyone. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we have here every Monday night at 9 p.m. Eastern Standard Time. We're here to answer any of your questions that you might have live, so please feel free to ask questions in the chat. We're also answering any questions that you or other viewers may have submitted over the week on our videos. Remember to like and subscribe to the channel and hit the notifications button so you can get notified when we put out another one of our videos. And remember, we're also on Facebook, Instagram, and Twitter, so please follow us over there and share this channel with your friends and family and anybody who might benefit from the information. So without further ado, we're going to go ahead and we're going to get started with questions that have been submitted this week. So we get a lot of questions every week on bleeding during pregnancy. And this week was no exception, but we had some interesting ones. So the first one came from a viewer who said, I had implantation success, by which I mean I'm pregnant. But I got my period, first day heavy and second day light, and then end. Should I be concerned? So bleeding is very scary for anybody who's pregnant. We associate bleeding with meaning that there is an issue. And in a lot of cases, bleeding can indicate a serious problem. So you always want to contact your healthcare provider or head to the local hospital if you don't have a healthcare provider so they can check you out. However, there are some normal causes of bleeding during pregnancy. One of them is a menstrual cycle. So it is very common that a woman will have a normal period for 1, 2, even 3 or 4 months after she becomes pregnant. It will show up at the same time every month. It can even have the same characteristics as your normal period. Of course, if you find this is happening, you want to let your healthcare provider know. But if they tell you that this is normal, you can rest assured that it probably is. Another person sent in a question that said, I am 14 weeks pregnant, and before I got pregnant, I was diagnosed with a cervical polyp. I'm spotting and bleeding, but I have not had sex since I became pregnant. Is it because of the polyp? So, a polyp is like a little kind of oval-shaped or round-shaped piece of tissue that will be in various parts of your body. We often think about polyps as being these little growths inside your intestinal tract. Now, sometimes when we think of polyps, we assume that they are cancerous, but most of them are actually benign, which means that they're harmless. Cervical polyps are usually benign and harmless. They're a little ball that kind of sits either inside the cervix, so this is your cervix, it's inside this area, or even on the outside. If you have an external cervix so that it's sitting down inside your vagina, if that gets irritated during sex, it can bleed, which is why this viewer is saying, I didn't have sex, so what could be the cause? It is possible that the cervical polyp has loosened a little bit and the tissue has torn, and that's what's causing the bleeding. However, in your case, I would make sure that you call your healthcare provider and have them assess you. If you really haven't had any sex or contractions, it's very unlikely the polyp is the cause of the bleeding, and you want to make sure that they check you out. Another question that we got about bleeding was, hello, I am 5 weeks pregnant and 5 weeks, and 7 days pregnant. Over the last 7 days, I've had brown discharge coming and it's turned to bleeding. Is it a cause for worry? So this is a great question, which allows me to talk about what bleeding looks like and when you should be super concerned. So again, with any bleeding, you want to contact your healthcare provider. But there are different colors of bleeding that tell you what stage you might be in. For example, brown blood is old blood. This usually indicates a bleed that has stopped and is resolving or clearing itself up. Light pink blood or pink is usually spotting. This is when the bleeding is almost none and it may be mixed with some fluids, normal vaginal fluids, which is what dilutes the color. Red, bright red, or dark red are the concerning colors. That means there's active bleeding going on. And unless you're at the hospital or your birthing center giving birth, active bleeding is not something we want to see in pregnancy, and we want to check it out. Now, if you are having bleeding and it goes from red to brown and you've already talked to your healthcare provider may tell you that's fine. I'm not worried about that change because it tells me the bleeding is stopping. However, when you go from brown, which is old resolving blood, to red, that is a very, very serious concern. And you want to let your healthcare provider know. Now, in one of the previous questions I just answered tonight, the viewer had said, I got my period. And I told you a period can be normal. However, again, just because you have bright red bleeding and is diagnosed as a period, you go to brown blood because it's resolving. If you go back to red blood, you cannot assume it's the same source of bleeding. So you want to make sure every time there's a change in your bleeding, including the color, the consistency, meaning whether it's thin or thick, whether there's clots or no clots, as well as the amount, if it goes from light to heavy, you want to make sure you contact your healthcare provider so they can determine how they want to assess you or check you out. Now, we had another question. I was pregnant for 6 weeks. Then I started spotting and bleeding for 5 days, including small blood clots on my panty liner. My OB/GYN said on ultrasound there was no heartbeat detected in my uterus. Before she gave me medicines for bleeding, I noticed that I stopped bleeding for 5 days. So I don't know what to do. So this is a very complicated kind of scenario, and I want to go over a couple things. So for those of you who aren't sure, blood clots are little pieces of blood. They look like little pieces. They can sometimes be round and look like the size of a coin. Some of them will be smaller and just look like pieces of tissue. Blood clots can be normal for women during their menstrual cycle and can also happen when you are bleeding during your pregnancy or also when you're having a miscarriage. Now, when you have an ultrasound at 6 weeks along during your pregnancy, it is very unlikely you're going to see a heartbeat. In fact, it's very unlikely that you're even going to see a baby. At most, usually we will see the gestational sac or this like basically round area that is actually dark inside. You really can't see a lot this early on. Now, some people will have an ultrasound and they will be able to see everything, and that's great. But just because they can't see anything does not mean that there is nothing going on there. In fact, most healthcare providers are going to monitor your symptoms, give you some guidelines, and repeat the ultrasound in a couple weeks. Now, the medications for bleeding was probably given because your healthcare provider is hoping to maintain the pregnancy, to stop whatever the cause of bleeding is, and to move forward, and hopefully everything resolves. So what could have caused this bleeding? So for starters, again, regular period. You can also have something early on called implantation bleeding. So implantation bleeding is the time where your baby, which at this point is a fetus, comes down into the uterus. This is the uterus, and they attach to the uterine wall. This is what's going to eventually form the placenta, which feeds your baby during your pregnancy. When this attachment is made, it's basically forming blood vessels between the uterine wall and the baby's new placenta. And sometimes there's a little bit of bleeding that will happen during that time. Now, it usually happens at 2 to 3 weeks of gestation, but everybody is different. And the thing is with pregnancy, sometimes our dates are off. Sometimes we think we know when we got pregnant and we really got pregnant at a different time. So when you're early on, it is possible that that could have been some implantation bleeding. There's also something called a subchorionic hemorrhage. This is a little collection of blood that will happen underneath that placenta. And we have a video on that. We'll link that into the chat for you. But subchorionic hemorrhages are often very common, and they result in no issues with a pregnancy. You can go to full term and have a healthy pregnancy and a healthy baby. Now, on this one also, we could have had bleeding caused by sex. So the hormones that are needed to have a healthy pregnancy, those hormones thin out vaginal tissue. So they thin it out and they make it easier for you to tear and bleed after sex, after even rough washing of yourself. If you're really rough trying to keep stuff clean, you can actually cause your vaginal tissue to tear. So this is another very common reason why women might have some bleeding. Now, in this case, this viewer said that her bleeding stopped before she got the medication, and she's wondering what she should do. So in this case, you need to call your healthcare provider. It's very important to determine what medication they're giving you and why. So progesterone is a common medication that's given. This is also designed to help give you hormones to maintain your pregnancy and prevent miscarriage. So, for example, even if you weren't bleeding, they probably would want you to continue the progesterone. So ultimately, your healthcare provider, who has all of your history, would know the answer to that. Now, the only other thing that I wanted to say about this is that, again, it's very important that you contact your healthcare provider. I know that it's repeating something that I've said over and over, but sometimes this could be the start of a miscarriage or an ectopic pregnancy. So ectopic pregnancies are pregnancies that occur in the fallopian tubes. Basically, the fertilized egg attaches to the fallopian tube wall instead of coming down into the uterus like it's supposed to. As that egg starts to grow, what's going to happen is it's going to burst the fallopian tube and it becomes a medical emergency for mom. These pregnancies are not viable and they cannot be saved. And in fact, moms will need an emergency surgery to remove the fallopian tube itself. So if you're getting early signs of this, we have the chance to intervene before it's a medical emergency, and the surgery could be far more invasive. If you're having a miscarriage, it's important for us to monitor you so that we can determine if you need further intervention or if the miscarriage is happening naturally. Now, if you're not sure what's going on and you're like, am I having a miscarriage? Am I not having a miscarriage? And your healthcare provider isn't giving you guidance, there is something that you can do. As you're monitoring your symptoms and keeping your healthcare provider updated, you can take a pregnancy test at home every couple days. If the pregnancy test remains positive, then you can consider yourself still pregnant. Another thing women can do is they can advocate for a pregnancy test using their blood. So this is something that has to be ordered by your healthcare provider. What they do is they'll draw blood, and a couple days later, they draw blood again from your arm or your hand. And then they measure the pregnancy hormone HCG. If the HCG level is rising, this indicates the pregnancy is progressing and appears to be healthy. If the HCG level is dropping, this is an indication that you are having a miscarriage. So this is extremely valuable for people who are very anxious and trying to figure out what's going on and how to proceed. So you always have the right to ask your healthcare provider if they would be willing to do that blood test for you. So those are great questions about bleeding and something that we get a lot of. For any of you who are joining us, please feel free to put any questions you have into the chat, okay? So the next question that I'm going to talk about is actually about yeast infections. So the first question is, I'm 18 weeks pregnant. I'm feeling itchy with pain after sex. I have smelly discharge, and discharge looks clumpy and yellowish sometimes. When I explain this to the hospital, they are not helping. What should I do? So yeast infection is a fungal infection of the vagina. They're very common for women, and they usually occur after you've had to use antibiotics. However, they can occur for a variety of reasons. Yeast infections are usually associated with a white discharge that is very chunky. For those of you who are familiar with cottage cheese, a lot of times we say it'll look like cottage cheese. Some women will have a smell and some women will not. Now, itchiness is a very common sign of yeast, and pain with sex is very common as well. Now, what do? You need to have them swab you. So they need to take a sample, that's the swab, and send it to a lab to determine what's going on. Well, so the chunkiness of the discharge does kind of sound consistent with with a with a yeast infection, but the yellowish color could actually indicate possibly trichomoniasis or bacterial vaginosis, which are two different sexually transmitted diseases that are pretty benign. Now, if that's the case, we need to figure out what's what, because with trichomoniasis or bacterial vaginosis, we're going to give you an antibiotic. With a yeast infection, we're going to give you an antifungal cream or antifungal tablet. And if you have both, we need to treat both. The reason why it's so important to treat a yeast infection is if left untreated, it can lead to preterm birth, miscarriage, or even stillbirth. So it's essential that we get that treated. Back to the sample. What they need to do is they need to lay you back and they need to open up your vagina, often using a set of, forceps to open up the vagina, right? So then what they're going to do is they're going to go ahead and they're going to take a sterile Q-tip, okay? This sterile Q-tip or sterile swab is going to be inserted into your vagina, and because they're visualizing your cervix and your vagina, they're going to look for that discharge and they're going to put that little Q-tip into the discharge to get a sample. Then they're going to take that and they're going to rub it on a dish in a lab and see what grows. After a day, they can check that growth and test it to see what it is. See if it's normal vaginal flora or if it's yeast or something else. And then they're able to determine your treatment. It is not normal to have smelly discharge. So if they're not helping you at the hospital, contact your healthcare provider or go to a different hospital and ask them, say to them, I want to be tested. I need to know what's going on. Now, if you have a yeast infection, you cannot just treat yourself. It is very tempting to want to go to the store and grab the yeast infection medication off of the shelf. And it is available on the shelf. The tricky thing is a lot of healthcare providers will actually send you back to the store to get what you're wanting to get yourself. However, it's important that you talk to your healthcare provider. If you have certain risk factors, let's say you're a high-risk pregnancy and you've had previous preterm births, maybe previous incompetent cervix, your healthcare provider may not want you to insert something into your vagina like a cream or a suppository. Instead, they may want to give you the oral tablet. Others may want you to use those over-the-counter products, and this can change from provider to provider and pregnancy to pregnancy. So you always want to double check with them and make sure they tell you what they prefer. Now, our other question about yeast infections is I had a fungal infection before my pregnancy, and now I'm in my 26th week of pregnancy. We tried to have sex, but we found that my vagina was very tight and it was very hard to penetrate, so we didn't continue. I experienced blood after peeing when I wipe with toilet paper. My vagina feels too tight and I have a urine infection too. Do you have any suggestions? So for this mom, it sounds like she needs to get the urinary tract infection cleared up. Urinary tract infections are extremely common during pregnancy, especially as the pregnancy progresses. This is because the bladder sits right next to the uterus and the baby's head just pushes on that bladder, so it's very hard for it to empty. So when your urine sits in your bladder, it ends up being able to build up bacteria, and the bacteria start to grow, creating the infection. Now, UTIs are the most common infection that women will have during pregnancy, and if left untreated, they can lead to preterm birth, stillbirth, miscarriage. But they can also lead to the need for an emergency delivery if the mom develops a systemic, life-threatening infection called sepsis. So what happens is that infection in your bladder will travel up the two ureters to the kidneys. And then the kidneys become infected, and this is extremely dangerous. So it's important for us to treat that. Now, when you're having a urinary tract infection, it's very possible that the whole area is inflamed, and inflammation can cause swelling, which may be why this particular viewer says that her vagina feels tighter. But secondary to that, if she has a yeast infection that has reoccurred or never really resolved, this will also cause vaginal irritation that can lead to vaginal tightness and swelling. Now, if you're trying to have sex and the vagina is very tight and small and you don't use enough lubrication, this could lead to that vaginal tearing that I was telling you about and some bleeding. So it's very important that when you're having sex that you are using lots and lots of lubrication. You can find artificial lubrication on the store shelves and you need to use it. Use it, use it, use it. Sex should not be painful. If it is painful, something is going on and you need to stop and have everything looked at. In this case, this mama should go to the doctor so he can take a look at everything and see what's going on and if there's any infection. Now, the other thing you need to be aware of is there's a lot of blood flow to that area of your body, especially the uterus, because the uterus is where the baby is living and the uterus is providing all the nutrients and everything through the placenta, and that's a blood flow exchange. Well, there's also blood going down to your vagina. So everything is just getting lots and lots of blood, which can create swelling on its own. Additionally, if you're having swelling all over your body where you're retaining water and fluid, that fluid, if left untreated, can actually cause swelling in many, many places, including the vagina. If you're not having regular sex, it's also very possible that you will have some like vaginal tightness as well. So what I would say is make sure you talk to your healthcare provider. But at this point in time, if everything looks good, you probably need to think about, possibly abstaining from sex for a little while and seeing if some of that swelling comes down. That was a good question. For any of you who are joining us, remember, please feel free to put any of your questions into the chat. All right. So our next question is actually about, came to us on our baby sleep video. So this question asks, what is a good temperature in Celsius for babies during the day and at night during each season? So this is a question that is extremely difficult to answer because it really depends on so many factors. It depends on like the outside temperature, the humidity, the weather conditions. Like there's so many facets to this. So what's more important is to figure out if your baby's temperature is normal. So a normal temperature for a baby on average is 98.6 degrees Fahrenheit or 37 degrees Celsius. Now, in the morning, your baby's temperature may drop to 36 degrees Celsius, which is 96.8 degrees Fahrenheit, and that can be considered normal. In addition, at night or by the late afternoon, your baby's temperature can rise to as high as 37.9 degrees Celsius or 100.3 degrees Fahrenheit. So you can see there's a wide variety of temperatures that can be considered normal. So one of the things that's very important for you to realize is that it's one of those things that we kind of take a look at and we try to see what works. It is normal for human beings to respond well to a drop in temperature in your house in order to sleep. Okay, that's actually very healthy for us and it promotes a normal circadian rhythm. Human beings respond to the temperature going down and the lights going down, which is why we want our houses to be dark. In the morning, when the sunlight comes out and the earth heats up, it's a signal to our bodies that it's time to wake up. Your baby will do just fine if you drop the temperature in your house, even by as much as 5 to 10 degrees. Okay. And if you're worried about if the baby is warm enough, you simply use a warmer sleeper versus a cooler sleeper. Remember, you do not want to use any blankets. Blankets increase the risk of SIDS. A nice warm sleeper is enough for your baby. So that's a great question. We got another question this week about carpal tunnel syndrome. How long after giving birth should carpal tunnel go away? So, carpal tunnel syndrome is a condition where you will get pain, usually shooting nerve pain, or even numbness or tingling in your hands. And this is because the carpal space right here, it can end up getting swollen or compressed, and it causes that pain to happen when that nerve is being irritated. It's extremely common during pregnancy, oftentimes due to swelling or different things. And unfortunately, in pregnant women, it can be extremely painful, like interrupting sleep, not being able to hold things. It's very, very devastating. So if you're a woman who has carpal tunnel during pregnancy, it's very important you get treatment. And treatment is usually, when it's severe, surgery. But of course, they're not going to do surgery on you. So there's a couple options. For one, you need to go to a hand specialist. Among other things, I tell people to go to the hand specialist, the hand surgeon, because if you see them before you give birth, you're an established patient. You can find out your options. And if you do choose to have the surgery, which is very mild, they can do it as soon as possible, as soon as you're ready after birth. Now, they are also the experts, and oftentimes they can give you a special brace to help support your hands and reduce your carpal tunnel symptoms. There are some medications that can help with the pain from carpal tunnel, including Cymbalta. Cymbalta or duloxetine is actually an SNRI, which is a type of antidepressant that also treats anxiety. The nice thing about Cymbalta is it also is indicated for fibromyalgia and pain. It's not a controlled substance and can be very effective for carpal tunnel pain. It is something that you wouldn't use Cymbalta just to treat carpal tunnel unless you were late into your pregnancy. Now, after you deliver, how long can it take to go away? Everybody's different. The biggest thing would be when the swelling starts to come down, which can be up to 4 weeks after birth. But unfortunately, for some women, once they develop the carpal tunnel, it doesn't go away without further treatment. All righty. So we got a question about antibiotics. Is metronidazole safe for my baby? I'm 6 months pregnant. So a lot of women are very nervous about taking antibiotics and other medications while they're pregnant. You know, we're designed to protect our babies with everything that we've got. And so trying to put a foreign substance into our body seems like counterintuitive. We get really worried. Are we going to hurt the baby? Are there birth defects, etc.? Now, remember what I said earlier. Infections that are left untreated can lead to stillbirth, miscarriage, and preterm birth. And so it's important to treat any infections that have been identified in the pregnancy. If you have an infection that's been identified and they prescribe metronidazole, it is safe for use during pregnancy. However, one of the things you need to be aware of is you need to take all of the medication. Once you start it, you need to finish it. So the thing about antibiotics is they're actually really cool because they make you feel better almost right away. Like within 24 hours, you're not feeling those symptoms anymore, which is awesome. So then after like a day or two, a lot of moms are like, well, I feel better. The infection should be gone. And I don't want to take any extra medication that I don't need. But the thing is that antibiotic didn't actually kill all of the bacteria. It killed most of the bacteria, which is why you feel better. It is very possible, and usually happens this way, that you don't take the full antibiotic dose, and a couple days later, your symptoms come back because the bacteria that was left over got tough and started reproducing. The problem is now, if your healthcare provider goes to prescribe the same medication, it might not work. And now you may need stronger and stronger medications. And that infection becomes more resistant and more serious and can actually lead to more serious issues for you and the baby. So if you decide to take the antibiotic, if you and your healthcare provider determine you need it, make sure you complete the entire treatment. So that was a great question. For those of you who are joining us, hi, I'm Samantha. I'm the maternity mentor, and we're here for another one of our live Q&A sessions. If you have any questions, please feel free to put them into the chat, and we'll try to answer them for you. Okay, so our next question comes to us about drying up breast milk. So she says in 1992, I had my daughter, and in 1993, I had my son. I breastfed both of them together. So they were 2.5. And then I just quit cold turkey and was on medication. Then in 2004, I had my son. So she has 3 children. My third child, I breastfed for 2.5 years and went cold turkey. It's now been 30 years and I can't get my breasts to stop producing milk. I squeeze them with my hand. I put cabbage on them and I don't know what to do. I know that I have massive cysts and probably even further than that. Please help. So, it is possible for both men and women to produce breast milk even when they are not breastfeeding a baby. So this is because of a hormone called prolactin. So prolactin is the milk producing hormone. This is the hormone that says to your body, I need milk, make lots of milk. Prolactin can be elevated for a number of reasons. So the 2 most common reasons are elevated prolactin due to a medication side effect or elevated prolactin due to a tumor called a prolactinoma. Okay, so the first step when you've had prolonged milk production like this viewer is to go to a doctor and have your prolactin level tested. They'll draw some blood from your arm and do the test. If it is elevated, which I suspect in your case it is, they're going to send you to an endocrinologist for a further workup. An endocrinologist is the specialist who deals with hormones in your body. As far as medications, the endocrinologist is going to review your medication history to see if you're on anything that might increase your prolactin level. A very common set of medications that does this are antipsychotics. So this can include Seroquel, Abilify, Risperidone, Zyprexa, Geodon. These are very common antipsychotics and they can all have this side effect. Secondary, the endocrinologist should order either head MRI or head CT scan. These are imaging scans that look inside your brain at the pituitary gland to check for a prolactinoma. That's that little tumor. If you have one, don't worry. This is not the end of the world. It's not brain cancer. It's usually a little benign tumor. This means a tumor that is not going to turn into an aggressive cancer, but they will usually do surgery to remove it. Okay. So it's very important that you go and get this checked out because the traditional methods for drying up breast milk are not going to work for you. All righty. We have a question here about placenta previa. I'm 19 weeks pregnant. I have a placenta previa. What should I do to help? So let's talk about placentas. So placentas are the organ that feeds your baby. It's a very vascular, that means it has lots of blood vessels, organ that attaches to the uterine wall, which also has a lot of blood vessels, and that's how we feed our baby. Now, your uterus is a big kind of oval-shaped organ, okay? At the bottom is your cervix, which is right here, okay? This is the cervical opening. Now, normally your placenta is supposed to attach right here on the side, okay? But sometimes we have a placenta that comes down here. This is called low lying. And sometimes we have a placenta that comes over the cervix, okay? So if it's kind of to the side, this is a partial. If it's straight on over, this is a complete placenta previa, okay? Now, you can have a placenta previa and have a completely normal, healthy pregnancy. Because as long as the placenta is attached and the blood flow is good, the pregnancy is going to continue. Your baby's going to grow normally. The concern with a placenta previa over the cervix is when it's time for you to give birth, this cervix has to dilate. And when this dilates, all these blood vessels become exposed, which means they're going to bleed. And they're going to bleed, and they're going to bleed, and they're going to bleed. And this can lead to a life-threatening hemorrhage for mom and for baby. So if we have a placenta previa and we see cervical dilation with bleeding, it's considered a medical emergency and we're going to do a cesarean section. For women who are diagnosed ahead of time with their placenta previas, they're going to go ahead and they're going to have a planned cesarean section. We usually try to deliver them between 32 and 34 weeks because unfortunately your body can start to dilate your cervix without really any active contractions. You can have silent contractions. You can have Braxton Hicks contractions. These are normal. And your cervix can start to dilate. And you can walk around with a 1 to 2 to 3 centimeter dilation of your cervix and be totally fine, except if you have a complete placenta previa or a partial placenta previa. So your healthcare provider will talk to you about those options. Now, one of the things that can happen during your pregnancy is the placenta can actually move. Okay. Now, a placenta cannot move by detaching and reattaching. Detaching is called an abruption, and that is also a medical emergency. So that doesn't happen. But what can happen is as the uterus, so your uterus starts out small and it opens and grows big, right? So when the uterus is small, your placenta may be right down here by the cervix, right? But then as the uterus grows, that placenta may move with the uterine wall and move up and away from the cervix. In the meantime, this viewer is like, what do I do? I have a placenta previa. What do I do? Nothing. You do nothing but monitor monitor yourself for bleeding. Bleeding would be something very serious. You do stuff to prevent yourself from having preterm contractions. So you keep yourself hydrated. You make sure you're getting light exercise, no heavy lifting, getting good sleep, drinking to avoid dehydration, and trying not to be stressed out. Those are the things you can do. If your healthcare provider has recommended bed rest, you want to ask them, what does bed rest mean? What should I be doing? What should I not be doing? And we have a video on bed rest, and we'll link that into the chat for you. Those are the things you can be doing. But other than that, you just have to kind of wait and see what happens with your placenta previa. So that was an excellent question. Our next question comes about pacifiers. So my baby's 6 months and hasn't used the pacifier like normal babies. She uses it as a teething toy. Is that okay? So pacifiers are wonderful, but they are not teething toys, and that is not a recommended use. There are tons of teething toys out there that are safe for use when your baby is teething. I would recommend you look at those. You don't want to use a teething toy that is full of any kind of liquid. Those are not safe for your baby. Most of them are plastic. You want to make sure that they are a BPA-free plastic. You want to make sure they don't have any detachable pieces, okay? A teething toy should not have something that can come off if it gets broken, because then that's a choking hazard. The thing with pacifiers is they are not designed for that type of use. When a baby is teething, they're like chewing, right? Because they have pain. So a pacifier isn't designed for them to do that rough chewing, and it can actually rip apart over time. Now, you might be saying to yourself, well, I'm with the baby, I'm watching the baby. Here's the thing. And of course, if you see a broken pacifier, you're going to throw it away. And if you didn't know that, throw away broken pacifiers. But what happens, it's got to happen for the first time, right? In order for you to have a broken pacifier, the baby's got to break the pacifier. And that first time the pacifier breaks, the baby could swallow some plastic. And that's why you shouldn't use it. Teething toys should only be toys that have been designed and safety tested for teething. If it hasn't gone through that, you don't want to use a pacifier for that. Now, additionally, pacifiers are recommended for use during sleep only, okay? We oftentimes use pacifiers during the day when a baby's awake to help soothe them, but really it's recommended for sleep only, because using a pacifier during sleep helps reduce the risk of SIDS. But when a baby is awake, the baby does not need a pacifier and shouldn't be using one if you can help it. By encouraging your baby to teethe on this pacifier, you may actually be creating a habit that will be hard to break. Okay. So that was a great question. For any of you who are joining us, we are getting close to the end. We've got a couple more questions, so please feel free to put any of your questions into the chat. Our next question comes about an incompetent cervix. I'm 22 years old, and this is my first pregnancy. I'm having twins and was diagnosed with an incompetent cervix at 18 weeks by chance and was prescribed progesterone. I needed an emergency cerclage at 20 weeks. I was told I had started dilating at the time of the surgery. The surgery was successful, and now I'm taking progesterone twice daily as my doctor recommended. The doctor told me to take modified bed rest until I give birth. What do you think my chances of delivering safely are, and what is the earliest gestation I can give birth at with the least risk? So, this was a complicated question that this viewer sent in, but it's a great question. So let's start. Incompetent cervix means a cervix that is not functioning correctly. So this is our uterus, this is our cervix. A cervix should be long, thick, and closed. Okay, that's what we want to see. What a cervix is supposed to do when you are full term is a cervix is supposed to dilate. And as this dilation occurs, the cervix also thins out and kind of just disappears. That's to allow a baby's head to come down. So an incompetent cervix is a cervix that's starting to do that, but you haven't reached full term gestational age. Then what can happen is if that cervical incompetence continues, we may do what's called a cerclage. So a cerclage is where we literally sew the cervix closed. We use special surgical thread and a needle, and we literally go in here. It has some risks, but it can be very effective. And we have a video on cerclages that we can link into the description. Now, this patient says that once this happened, she was given progesterone, which can help to maintain healthy pregnancy levels of progesterone and prevent preterm labor. And she was told to do modified bed rest. So we have a link on bed rest that we've already put into the chat tonight. The thing with bed rest is it's very complicated. It's not what people think. It's actually not good for you to just stay in bed 23 and a half hours a day. That can actually lead to a lot of serious issues for mom, including clots and pneumonia. And those two things could cause you to have an emergency delivery. So you want to make sure that you're following bed rest the way your healthcare provider tells you. And usually it's a modified bed rest. It's a bed rest where maybe you can walk around your house, but you can't walk around outside. Maybe you're allowed to sit in a chair. Maybe you're allowed to take a shower. Maybe you're not. So you have to ask and see what that looks like. It sounds like this viewer is getting a lot of really great care. But now, like most moms, she's asking, what are the chances of me delivering safely? And what is the earliest gestation I can give birth with the least risk? So for starters, she's having twins. That means twins are smaller to begin with, okay? Twin pregnancies are much more high risk and they're much more complicated. Amongst other things, it depends on whether both twins' placentas are functioning right, whether they're both growing normally, etc. Additionally, and this is not meant to pick on a gender, but baby boys tend to be a little bit weaker in utero than baby girls. It looks like baby boys' lungs tend to be a little bit slower to develop than baby girls. So a baby girl has a higher chance of being healthier born earlier than a baby boy does. Now, this is not universal. You guys got to understand, every pregnancy is different. Every health history for that mom is different. The environmental factors, the nutritional factors, it's all different. So there's no guaranteed here or there. Now, when we talk about what's the earliest that your baby can be born and have the least risk, there's no way to know that. So we used to consider viability. Viability is the gestational age at which a baby can live outside of the womb or the uterus, outside of mom's belly, and survive with medical intervention. We used to consider that to be 24 weeks. And in the last couple of years, it's dropped down to as early as 22 weeks. However, babies born between 22 and 24 weeks gestational age often have a lot of serious medical issues. Okay, these babies can have lifelong issues, including cerebral palsy, blindness, issues with their gut, etc. We will do everything that we can as healthcare providers to prevent this. This is why healthcare providers try to keep your baby in as long as possible. You usually will get steroid treatment. We also try to give you magnesium infusion. These are all designed to help your baby. The steroids help develop your baby's lungs, and the magnesium helps to protect the brain. Now, as you go along, there's time frames that we consider like milestones to be happening during your baby's development. So, 24 weeks is a milestone, 28 weeks. It's usually every 2 weeks, to be very honest. And each time these 2 weeks pass, your baby becomes bigger and stronger. Now, just so you know, keeping a baby in for 1 hour extra makes your baby stronger. Every single minute we can keep your baby in your belly, as long as you are doing well, that is essential to your baby's chances for having a healthy outcome. Now, one of the other things you need to understand is there are babies that are born at 24 weeks and they are totally fine. They do their hospital stay. It's still a long hospital stay, but they don't have any serious issues. They go with the flow. They grow up. They get big. They go home. And then there are babies who are born at 38 weeks, where we consider them to be almost full term, and they can have serious medical issues and end up in the NICU for the same amount of time. So the best thing I can tell you is there's no way to know for sure. And anybody who gives you some kind of odds, I would tell you that they are probably not doing you a favor. It's a journey. And every single parent who's had a premature baby will tell you that. You have to have a lot of patience, and you have to just go with the plan. The nice thing is the units that take care of these preterm babies, they are used to having scared parents. They will answer all of your questions and keep you updated all the time. And you just have to go with it. So try to keep yourself healthy and try to keep doing everything your doctor is telling you to do. Now, delivering safely, I think you're referring to the baby's health, and that's important. But the other thing to know is that it's important for you to know that you can also deliver safely and have a safe birth for yourself. Incompetent cervix really doesn't affect the mom's health at all. As far as the cerclage goes, if the cerclage is successful, when they go to let you give birth, let's say you go to full term, all they do is just snip it and it's open, and then they let your body do what it's going to do. So you can absolutely deliver safely and healthy. That was a great question. So for any of you who are joining us, please feel free to put any questions you have into the chat. I'm going to answer our last question of the night here. This is kind of not a question. We had a comment last week, and this was another comment on the same video, and I felt like it was very important to talk about this. I never wanted to have children due to clinical fear of pregnancy. I was worried about the pain, vaginal tears, and all of the things that could go wrong with my body. I feel like I would only give birth if I got knocked out and had a cesarean. I wish test tube babies were a thing. So a lot of women are very scared of both pregnancy and childbirth. It is actually extremely common, but women don't talk about it. Because the thing is, when we say we want to have children, and a lot of women want to have children, it's like weird to then say, but I don't want to get pregnant. I'm scared of pregnancy. And yet it's so super common. So if you are afraid of pregnancy, one of the things I'm going to tell you is there are support groups out there for women like you. There are one of the most evidence-based treatments for this is therapy. Okay. I'm not going to be one of those people that say, oh, well, then adopt. Well, adoption is a whole thing on its own. And maybe you want to have a biological child. Another thing that people often say is, oh, well, just use a surrogate. Surrogates are expensive. They can cost thousands and thousands or tens of thousands of dollars. So it's not just that easy to say, oh, just do something else. Instead, what I would encourage you to do is I would encourage you to start therapy. Cognitive behavioral therapy is a way for you to address those fears. It's a way for you to explore what might be going on. What's the root of this fear? Is there any strategies I can use to help manage it? One of the best techniques for helping you get through labor and having potentially a medication-free labor is to have hypnobirthing. Okay. Hypnobirthing is a technique where you get hypnotized and you can use different strategies to avoid pain. Well, the thing with hypnobirthing is the techniques in it can also be used to manage fear during a pregnancy. It's a method that deals with anxiety and coping. So this is one of the things that you can also learn ahead of time. You can spend time exploring without medication ways to cope with stress and anxiety. You can build your village going into a pregnancy. You can make sure you have all the players in place, your friends, your family, your partner, and let them know what's going on and tell them, I'm going to have moments where I'm scared, and can you just be there for me? You can pick an OBGYN ahead of time, and you can ask them questions like, will you give me drugs? There are plenty of women who don't want to feel anything. They want to feel absolutely nothing. And they ask for an epidural literally when they walk through the door. That might be an option for you. You can talk to the anesthesia staff and tell them your concerns and ask for your partner to be there, or ask for like a doula to be there with you, somebody to help alleviate your concerns. There are ways to manage this. But in the end, if you choose not to get pregnant because you are very fearful of this, that is okay. It is so essential that you not feel bullied into pregnancy, because these fearful pregnancies, these pregnancies full of this anxiety, can lead to an increased risk of postpartum depression and postpartum anxiety afterwards. Okay. So just understand that you are not alone. Without further ado, we are done. I really appreciate all of you for joining us. I'm Dr. Samantha, the maternity mentor, and I'm so glad you were able to join us here for our live Q&A session. We're trying to be here every Monday at 9 p.m. Eastern Standard Time. We're here to answer all of the questions and comments that you've submitted onto our videos this week, as well as any questions or comments you have live. Remember to like the channel and hit the subscribe button and the notification button so that you can get notified of our latest videos. And we have a fantastic video coming out tomorrow that I think you guys are going to enjoy. We are also on Facebook and Instagram and Twitter. Please follow us there. Share this channel with your friends and family. We really appreciate all of your support. We love to interact with you, and we hope to see you again. So I'm going to say goodbye for now. I'm Dr. Samantha, the maternity mentor. Have a great day. Bye, Jennifer.